So it's really my pleasure today to introduce Ellen McGratheny. So Ellen and I have known each other for a number of years through an online community. This is our first time to meet each other in person, so that's really exciting for me. Ellen has had a number of different jobs in university leadership and communications. Currently, she's the Vice President of Content Strategy. Did I get that right, Ellen?
Senior associate, but you know how academia is, we don't care. I do content strategy.
Content strategy for Syracuse. Before that, she was the communications director for the Duke Margolis Health Policy Center. She's worked for the UNC Cancer Center and communications and other places. She also writes a column for the Chronicle of Higher Education about communications and academic leadership. So she's really a wealth of knowledge about how to lead in academics and how to talk about what we do.
Thank you. So this morning, we're going to get opinionated first thing in the morning. And we're not going to use PowerPoint because this is an interactive discussion this morning. And it's great because then you don't have PowerPoint poisoning first thing in the morning, and you get to be opinionated. So this is a participatory, this is community-based participatory discussion. So I would like to go around the room real quick and get your name and a little bit of it. Just give me like the 2-sentence elevator summary of what your work is about. Okay? Can you start?
My name is Maya Sabeo. I'm the first year of my PhD in epidemiology, and I work for CFAR as the data for care management.
Great.
I'm Sarah Rutland. I'm one of the Freedom Parole Fellows here. I'm wrapping up my dissertation on unmet need for healthcare as people age from adolescence to adulthood.
So I'm wondering if I'm supposed to be wearing the mic for the purposes of Zoom.
Yes.
But let's just continue around the room. And no, it's not hurt.
I'm Allie Pinzaria, senior creative board med school, the Field 1 Freedom Parole Fellow, and my research is focused on HPV vaccine acceptability and hesitancy in Latino mothers.
Cool. I worked with the patent holders for Gardasil at Louisville. They're great people. Yes. Our biggest story there was about typing manatee papillomavirus because, you know, animals always get you great press.
I'm Nick Cataldo. I trained as a gynecologist and reproductive endocrinologist, went back to school to get a PhD in epidemiology, now starting my third year, scratching the surface of education on women and chronic disease and HIV.
Great.
I'm a statistician in the Division of Hematology.
Do you have a name?
Aiden Gilbert. Sorry.
Okay.
I missed the whole
That's fine.
Yes,
I'm Frank Leeson. I'm a general surgery resident. I've taken 2 years off to do research. A lot of the research that I did at the VA for the quality improvement program. I'm also working on some healthcare outcomes.
Great.
Sam Baker, also surgery resident. In my second year of research, doing looking at health literacy and readmissions into the VA and general surgery.
Colin Florida, I'm a pharmacist. I'm doing the VA Quality Scholars Fellowship. I'm doing a lot of improvement work in our oncology clinic.
Good. We need more, you know, engaged pharmacists who are outreach fixing. That's fabulous.
Bruce Julie, doctoral student in medical sociology, and my research interests are mental health disparities and children.
So y'all, medical sociologists fascinate me. I work with some very cool people, so get to know this guy.
I am I'm a first-year epidemiology PhD student, and my research interests in cardiovascular mentally in school.
Okay.
Hi, my name is Jacqueline Lambert Davis, VA Quality Scholar, and my research interest is in nursing care.
I've worked with some amazing nurse scholars, nursing professors, nurse scholars. In fact, I just called one because I needed advice on some care for my father. I was like, I need help. Go ahead.
I'm Haley Bednars. I'm a 4th year in the clinical psychology PhD program here, and my research is autism, neuroimaging techniques.
I'm Yulia Cornell. I'm a general medicine fellow. I'm interested in cardiovascular disease, epidemiology, and health outcomes research.
Good morning. I'm Mike Mugavero. I'm in infectious diseases,
do HIV engagement and care research with community and public health partners.
Great.
I'm Jamie Anderson. I'm a PhD student in health services research, and I work in knowledge translation and information science.
Great.
I'm Trudy Horton, back for round 2.
Woo.
Yeah. So I'm in preventive medicine, program director for the clinical and population health sciences program.
Hi, I'm John Merchant. I work for CCTS and our Center for Outcomes and Effectiveness Research Center. I help manage the TL1, the KL2, pre and post doctoral programs, as well as the T32.
I'm Josh Blackwell. I'm between my third and fourth years of medical school as a TL1 pre-hospital fellow, just like Allie. My research this year is focusing on predicting linkage to care outcomes for hepatitis C patients.
My name is Jim Bach, and I'm the Assistant Vice President for Public Relations. We do communications for the university and health systems, and one of the things we do is media relations that relates to the presentation.
Hi, my name is Molly Gasconi. I'm an assistant professor in the School of Health Professions, and I study healthcare payment reform efforts in the Medicare population.
I've been there.
Hey, I'm Courtney Williams. I'm a statistician in HEMOC and a doctoral student in healthcare organization policy.
Wonderful. So if you all don't have, there are some more handouts floating around here. And this is, I will make sure that Becky has the handouts. She has them in their original form, and you are welcome to have this. This is everything I'm sharing today is completely, you know, everybody should take it, use it, adapt it, and I'm happy to have you do that. So, yes.
You did? I think we are.
So I wanted to start out today. I mean, there is a reason why people come to an op-ed workshop. Do you read op-eds? Anybody? Do you know what an op-ed is? Okay. So an op-ed is when you have the opportunity as a citizen who can contribute something to the body of knowledge in the world to talk about something that you're passionate about or you have expertise in. And one of the things that we academic communicators like Jim and I do is we like to encourage faculty and students and trainees to do op-eds because it is a counter narrative to a lot of the nonsense that is out there about science, right? So who has read something in the newspaper or online that is about your field that has just made you incandescently angry? Anyone? Or who'd made you roll your eyes and say, these people haven't read anything? Yes, 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 yes. Okay. And what's interesting to me is going around this room that a lot of people in this room are in fields that are adjacent to public policy issues and to issues where people have opinions that are very tenaciously held and widely uninformed, right? So things around HIV stigma, things around mental health, issues around autism and vaccines, issues around you should do this diet, you should do that diet, you should do the other diet. You know, everybody in the world should be on statins. Nobody in the world should be on any medication. Those are the kind of things that we need more informed voices out there, and that's why the opportunity to do op-eds can be a great way for folks who are actually discovering new knowledge, actually have a really strong grasp on the field, are actually coming to data-driven conclusions in a world where we know that the news is not necessarily fact-based, right? Okay, and that's a challenge that we have right now. So we're going to work today in an interactive way, and I'm going to talk a little bit about sort of the structure of an op-ed and the mechanics of getting started and sort of the major do's and don'ts. And then I'm going to give you the opportunity to sit and maybe write an opening paragraph of an op-ed on a topic that you're passionate about. And then we'll talk about what you've written. If you're brave, you don't have to share, but I'm not going to make anybody do that. But if you're brave and want to share, we can talk about the approach you took and ways to workshop it a little bit, and how things might proceed from your opening paragraph. And so does that sound like a good agenda for today? All right. So who follows the news closely? I mean, I'm married to somebody who was in the State Department, and he's a foreign affairs junkie, and he follows the foreign affairs news at a level of minutia that I will never achieve. right? But I happen to know a lot about what's going on in higher education. So who follows the news in your field pretty closely? Anybody? On social media, other places? So how do you know when something's trending? Besides Twitter hashtags, which, you know, can be anything. Anybody? How do you know when something's trending? How do you feel it? Do people talking about it? Do you see it on social media? On Facebook? Yeah. Okay. So one of the best ways to get a track record of success in placing an op-ed, which is a column about your opinion that makes an argument, is to follow the news and to be able to react quickly and have a point of view. So if you know a big report's coming out, a big study's coming out, if you know that there's a public policy issue that's under debate, that is something that's related to your work that you'd like to comment on, that's a great time to start thinking about it. Because often the first mover advantage, the first person who offers that op-ed to a newspaper or an online outlet is the person who gets that op-ed placed. Okay? So follow the news. And I said this yesterday, so it's a little bit of a repeat for a couple of people. In academia, we train you to write so that you cover every single possible objection or point of view on earth, right? Because that's where you're going to get up and do a conference paper and the person out of left field is going to say, well, actually, and, and you know, you're writing to stave that off, right? In an op-ed, you do the opposite. You strip everything away to the core argument, okay? So you start with a core argument, and if that argument has an attachment to something that's going on in the news, then that's what's going to get you published, okay? So one of the things that has been big in a lot of states, and somebody just mentioned it a minute ago, is the issue of Medicaid expansion versus continuing with the type of exchange-based ACA health insurance that we have. And that's an issue that's been floating around out there. So there are a number of ways that you can look at that issue. If you're a health services person or a health policy person, you can look at it from the standpoint of the market, of cost, and of public policy. If you're a nurse, you might look at it from the standpoint of what does this do to the balance between preventative and acute care. If you're an emergency physician, you might look at it from the standpoint of, you know, how does this help us alleviate some of the burden of EMTLA? If you're in infectious diseases, you're going to talk about how does this help us increase the vaccination rate and get us to a point where we're not worrying about herd immunity because everybody has decided that they're too smart to forego the measles vaccine, right? Those are all examples that I just drew from your all's introductions about how you might connect your work to one issue. You know, medical sociology, you folks, I mean, I was saying yesterday, I worked with folks who looked at the Affordable Care Act exchanges and how people interact with them. And, you know, people don't understand what the difference between an out-of-pocket maximum is and what their copay is, or what their you know, the minimum you have to meet before your insurance kicks in, which I haven't had a lot of sleep, so sometimes I will lose the word there. But, you know, people don't understand those components of health insurance. And so if you're a medical sociologist, you might be like, well, you know, if we had Medicaid expansion, it removes that barrier of having to figure out what you can afford, what it's actually going to cover, and whether I'm eligible, right? And what tier I'm paying at. So those are all really great, good examples drawn from this room about how you might link your work to something that's in the news currently. Okay, so you figure out what you want to talk about and you strip that argument down, okay? And what I recommend, a lot of people will just dump their brain and then strip it down. I find that more difficult because what happens is you get attached to your own prose. What I'm going to suggest is that when you are thinking about an op-ed, which seriously, I've written op-eds or edited op-eds for people who used to be FDA commissioners and Medicaid administrators, and I don't care how important you are, nobody is going to publish an op-ed that's over 750 words. Okay, it's just not done. People do not publish op-eds with more than 2 authors unless it's like an unbelievable consortium. Like last week or earlier this week, all of the living FDA commissioners came out and said the government needs to cut the FDA loose so they can be an independent regulatory body, right? Now, how that happens, I happen to know that none of them agree on the mechanics of that, but unless it's something really, really momentous like that, nobody is going to publish more than 2 authors, more than 750 words. Choose your argument. You may have 3 or 4 great salient points of view on this topic, but make a single point and make it well. So when you're outlining this, you kind of start with what is your big idea, and you start with that. This is not academic writing where we talk about our methods, our introduction, our lit review, our methods, our data set, and then that somewhere in the bottom in the last 3 paragraphs is your conclusions and discussion, right? You want to put the point of all of this up there first. It is your headline, okay? That is your headline, right? Your headline, and I know that everybody in this room is flinching because headlines in biomedical research and health services research and outcomes research are all about hype, right? Hype versus hope. That's what we talk about all the time. But you control the headline of an op-ed in most cases. And generally, if you get one accepted, the editors will work with you on what that headline is. Here too, your headline has to be short or they won't print it. And I'll tell you the funniest thing about, you know, unexpected influences of technology. All of the major newspapers use a content management system like you do if you blog or if you manage a website, and there is a character limit in those headlines. And you don't want to bump up against it. So try to get as short as you can and as pithy as you can. Then put your main point right up top. And here's the thing, in academia, we're trained to not use the first person. In an op-ed, you can totally use the first person. I am a biomedical scientist working on issue A. I am a practicing physician working on issue B. I am a nurse, researcher, and instructor and professor working on this issue. You put your credential right out there. It's okay. You can put it, sometimes they'll let you put like who you are or your title, but you can start with as a person who is affected by this issue in this way, or as a person who sees patients who are affected by this issue in this way. You know, this is my opinion about this issue. And write in the first person, don't write in the third person. As we have seen, is not what you want to do in an op-ed. You want to be emphatic, right? Because look, y'all, I know academics, 20 years in this stuff, you all have opinions. You do. And we want you to get them out there. Make sure people know why they should care. And I always say, you gotta, when you're telling a story, and an op-ed in a lot of ways is a story, you want heart and head, right? So we tend to be sometimes all data driven, right? Because we're spending a lot of time looking at big data sets, or we're all data driven, or we're looking at this. But, you know, fundamentally, everybody in this room is here because they know that real, actual people are affected by the dysfunction in our healthcare system, or by emerging infectious diseases, or by lifestyle factors, or by other things. And you're here fundamentally because you want to help people, right? You know, you're here because you want to eliminate disparities. You're here because you know that there are structural issues that affect public health. You want to help people. So make sure, if you have a personal story or a way to make it personal, use your heart and your head. That tells the readers why you should care. Offer specific recommendations. So if something's pending in front of your legislature that you think is the stupidest idea ever, you should say, I oppose this bill and encourage my legislators to vote against it because of these reasons. So specific recommendations. And again, showing is better than discussing. You know, here's some numbers that back this up. Here's what I've found. Just in the last week, I saw 3 people in my practice who had this problem. Those are all things that are tangible and credible. And we know that people have cognitive biases, and we know that the general public and journalists in particular are not really numerate. So try to stay away from statistics, because unless you can say something like 1 in 3 or a simple 70%. I have a list of resources here that I'll pass out, but one of the best books out there for if you are in a very heavily statistical field, and I know there's a couple statisticians in here, there's a book called What is a P-Value Anyway that explains in a lot of ways how to create statistical numeracy in your writing and convey statistics in a manner that helps people understand what it actually means, right? So I think that can be really helpful. Okay. Then this is you writing. This is you as a person writing. We're not academic bots. So again, heart and head, if you have a voice, use it. And your personal connection. Okay, short sentences and paragraphs. This is probably the hardest thing in the world, and Jim's back there laughing because I've been in academia a long time, and I've been somewhat assimilated, and right now I'm working for a chancellor who is a former law professor, and he writes, like as my husband describes it, who is also an attorney and former diplomat, like watership down, subject, verb, object, subject, verb, object. But short sentences are better because you want to avoid losing people in the middle of your argument. So we tend to do this thing where we're like, okay, here's the big point I'm trying to make. And by the way, here's this really interesting aside. And let me go back and talk about the main point again. That loses your reader. An op-ed needs to be like ruthlessly linear. Ruthlessly linear. Avoid jargon. There are lots of great resources out there on how to translate medical terminology into lay terminology. I ran into this when I was redoing the website for the Lineberger Comprehensive Cancer Center, right? Because I've got people who are going to Google a procedure in lay terms and not find it because we only have it in medical terms on our site, right? So, I had a cardiologist I worked with at University of Louisville, and it took me 3 years to get him to say heart attack on the first TV interview and not myocardial infarction, which is even better if you imagine somebody with a pretty thick Italian accent. But he got really good finally about saying that. And then he went at the end, he's like, you taught me that if I can't explain it to my plumber, I'm not explaining it well. And I was like, yes, I get through after a while. And then again, active voice, no passive voice. Don't argue with individuals, argue with the policy or the action that you want to make happen. Acknowledge the other side, but don't be defensive. Don't get into it. You can acknowledge it and dismiss it. But again, this is not a conference paper where reviewer 3 is out there going, well, hey, you forgot this whole other field that is only tangentially related and doesn't really add anything to my argument. Make your ending emphatic. Don't just say, and this is what I think. And if you have graphics that support something, offer them. Again, we talked a little bit yesterday about pre-publication, but especially the policy publications, so Politico, The Hill, Axios, Morning Consult, Kaiser Health News has dined out on visuals. Kaiser Health News is actually a great place to look for how people construct visuals in a way that resonates, because they do a lot of A/B testing and they've really perfected how to do great health visuals that make a point, that are understandable to the general public. And so, you know, if you want to learn how to do something well, go watch somebody who's doing it well. Okay? Most places will allow you to submit the articles through an online portal. Some of them will require you to submit them through an online portal, and I'm looking at you, Washington Post. The New York Times in general will make you do that. But you need to talk to people like Jim, because they have sometimes created relationships with op-ed editors who they can reach out to and get you a little bit more of a second look or a personal connection. And being responsive gets you that personal connection, and being, you know, out there ahead of the news just a little tiny bit gets you that personal connection. So a lot of times you want to look first and submit it through the portal, but also let your communications officer know what you're doing, because it's literally our job to help you do this well. And then there are other places that maybe don't necessarily require an editorial approval that you can post. There are blogs, there are places like The Conversation, which is a blogging platform that's mostly academics. There are a lot of other, HuffPo and some others will take general kind of op-eds from people in various areas of expertise, as long as you're not like the 14th statistician to write them and to ask to do it. But, you know, work with your communications person to do this, because it's our job to help you. And we know folks, and we know generally what they're writing about and can help you match up what you're writing about with the right person. Okay. Yes.
As I'm listening, I'm struck that a lot of what you're saying to me resonates with approach to academic medical writing. I mean, flipping a little bit in terms of the first person and those things, but the idea of bold opening, strong conclusion, short, concise sentences, simple graphics that are easily digestible. So I'm just wondering, I'm just thinking that it's really interesting, how can what folks are more experienced with and trained with in academic writing, it sounds like a lot of that could translate to writing op-eds.
A lot of it can absolutely translate. And there's a kind of a hybrid out there that's emerged over about the last 5 years. So like the JAMA Viewpoint or the New England Journal of Medicine, I can't remember what they call it, a comment or a letter. You know, there are now more formats for, and that's a place that you can be a tiny bit more technical or a tiny bit geekier than you can be in the general news press. But there are a lot of people who publish those pretty frequently. And if you look at their writing style and look at what's working in those venues, you're going to really increase your chance of successfully submitting something. And any JAMA will publish, they publish more viewpoints online than they do in print, so there's more opportunities than you'd actually think to publish a JAMA viewpoint. And it doesn't necessarily have to be connected to something that is in that particular issue of JAMA or has been recently covered in JAMA. You can actually write about all kinds of things. And again, that's something where your communications office, who we're in touch with them, we're already registered with JAMA, we kind of know who the people are, can help you, hook you up and get you in front of them. But there's some people, if you look at the people who publish pretty frequently in those venues, you will see there is a model that they use in a viewpoint, and that's where your figures, your simple figures, really come into their own.
You know, I'm wondering, just as you're talking, thinking about has academic writing and reviewing evolved, and I just again think about some of these principles you're talking about, and as applying them to some of our grant writing. With the CFAR renewal, we had a consultant, and a lot of what she said was go to the heart. So stop being so data-driven, like telling some personal stories of, you know, having this experience with this, you know, patient, you know. So it's just interesting. I'm just wondering if as there's some evolution, some of these principles could actually help us improve our grant writing.
I think it could. I do think that there's an evolution with the NIH moving toward broader impacts. And if you don't know what that is, go Google it, because they have a great website. There is more tolerance for not having that like super detached third party, let's only write in the passive voice, okay? Now that didn't mean that our training has necessarily caught up with that. I spent the last 2 years editing people who had masters in policy primarily, and boy, you know, the passive voice, I had to retrain them. It usually took me about 6 months to get them out of passive voice, but and my favorite comment to do that is, don't write like Yoda talks. All right. that's passive voice. Don't write like Yoda talks. But I think there is more tolerance now for that personal voice or for the personal connection and that understanding. And yesterday, and I'm happy if the statisticians want to hear about this a little bit, I shared an example of somebody that I worked with who was a blogger on completely wonky ACA market issues. And he was blogging anonymously because his health insurance employer frowned on him blogging. When he came to Duke, we're like, academic freedom, we don't care. So I helped him unmask from his pseudonym. And I helped him, his name's Dave Anderson. If you follow him on Twitter, if you're interested in ACA markets, he's completely like the most geeky human I've ever met, and he owns it. He's a good friend. He really learned to write just a little bit less wonky, like to walk people through your numbers in a way that's much more simple. Like to give an example of, here's a family of 4 people making this much a year, and under the old proposed changes, they would pay this, under the old way, they would pay this, and here's why. You know, really helped him do that. And he is the only person I've ever worked with who's been invited to write an op-ed for the New York Times. Right? So there's hope for everybody. There is hope for everybody. But yes, that personal voice is great because it really helps differentiate what you're saying from just kind of the general hum of background noise. Y'all know we see about 10,000 messages a day. When I was a kid in the 70s and we only had 3 networks, it was more like 2,000, 2,200 a day. And that's probably true at and okay, you know, we all know the difference between a mean and a median, right? So that's probably true at the mean, but the median is probably higher because old people like me skew it lower than young people. Because you're looking at your phone more, you have more messages coming in. Okay. So if I gave you 20 minutes to write a little bit about your topic. So what I would like you to do, and you can do it a couple different ways, okay? If you've got a laptop and you feel like you're going to write beautiful prose this morning, you can go ahead and write it out in sentences, or write me your headline, the first couple of sentences, and then outline in bullets how you would structure the rest of your argument about your topic. And then brave people, we will read them and we will talk about what you're doing and how you're arguing, and we'll talk about how you might improve it, or if you just need to tweak it a tiny bit. Does that sound? Were you expecting participatory research this morning, folks? Okay. Okay. We have pens. Oh, the other thing I'm going to hand out, and this is mostly for the biomedical folks, it's not as like applicable to outcomes research, but when I was training public information officers on, and this is like how to keep Jim from getting upset with you, okay, this document is, I realized that when I worked with a faculty member that I was running down a list of questions in my head about their work, about where it was in the process, about research, and I created this public relations assessment tool for training communications officers who didn't have this in their heads. I just dumped it out from my brain onto the paper. And so this is a matrix that you can use to end. Again, we're going to have copies, and Becky will just hand them out, and you can hand these across the back row. These are questions that you can ask about your work, and then all the regulatory stuff. So by the way, you all know if you write something about NIH-funded work, you have to create your grant number and all that. So keep everybody out of trouble. But these are a series of questions that you can ask that will help you maybe develop your angle, right, on your work. Why is it important? Why is it important? Where is it?
And if anybody wants to move to the table, there's plenty of seats up here.
Yeah, I mean, come on, y'all. There's plenty of places to sit. And we're going to stop at 5 minutes till and share. I'm seeing lots of quizzical looks. And if you want to consult, raise your hand. Yeah, it's maybe 50 or so. Hey, folks, maybe about 5 more minutes. Okay. No panic. Okay, folks, it looks to me like at least some people are at a good stopping point, and I want to get to the fun part, which is working with you and hearing what you have to say and your opinions. And I always say the reason I work in higher education is because I'm easily bored and I enjoy learning from people like you all the time. So this will be a great opportunity for us to kind of hear a little bit about how you might approach getting your opinion, which is educated and science-based, out there on issues that are of interest to the general public. So is there anybody who would like to start? And what we'll do is just ask you to read the first paragraph if you're willing to do that, and we promise to be kind. So anyone want to volunteer? We don't bite, I promise. Okay.
Okay. Communities keep older adults out of the hospital is my headline. And frequent hospitalizations are devastating for older adults. The stress of illness and the disruptive environment in hospitals can cause delirium, disability, and even death. Additionally, hospitalizations have an immense cost for individuals, for families, and for the healthcare system. For these reasons, repeated hospitalizations are a major focus for clinicians, policymakers, and researchers like me. In recent years, Medicare has enacted policies to reduce repeated hospitalizations for older adults. Hospitals and clinicians have changed clinical practice in response to these policies. However, these changes have failed. More than a quarter of older adults with heart failure still wind up back in the hospital within the month. Worse, the risk of death after hospitalization for heart failure has actually increased. To make real progress in reducing frequent hospitalizations, we need to build resources within our communities to support older adults to regain and maintain health and independence.
Okay, she's brave. Yay! Applause for the brave. Okay, so this is a great topic because it's a topic that probably has touched everyone with older people and their family, right? So there's a great way to forge a personal connection with the reader. What I would suggest structurally is I think your headline's great, but I would take the last sentence in your introduction and move it to be the first sentence in your op-ed. And then I would take the numbers that you cite and make them the second sentence. And then see if you can find, before you launch into here's what policymakers have tried and they've failed and here's what we need to do, to figure out if there's a personal story that you can tell about a person, an individual, grandmother, father, friend, relative, across the street neighbor. Okay? But that is such a great topic, and you've got all of the elements there. You just flip it, and you'd be great. It's a great op-ed. I just talked yesterday a little bit about a friend of mine who is writing, and this is really true in issues where your research, especially outcomes researchers, people here, your outcomes research should affect policy a lot more than it does, right? And we know we're like raising our hands and saying this works or this doesn't work, and this really simple intervention and nobody's doing it, and they're just beating your head against the wall. Well, this is a great way to get that stuff out there. And when you're thinking about talking about policymakers, try to make it personal first. And so work that in a little bit. But you've got all the elements there, right, for something that's compelling. And what you're going to argue is that we should do these different things. You give that intro, give your argument about why we should do these different things. Explain what we should do, A, B, C, D. Then you can acknowledge the counter argument. You know, policymakers have tried these other things. And then if you want to end with a bang on this, you know, you can talk about keeping people out of the hospital and the money we'll save as a society and all of those things. Now, so I talked a little bit yesterday. I've got a friend at Duke, Don Taylor, who writes about end-of-life issues and palliative care. And he's lost his mind and is writing a book based on his experience with his mother-in-law. Because y'all know who work on end-of-life issues or with rehospitalizations or older people, we live forward, right? And then we gain all this knowledge and then you have nowhere to put it to use, right? So people whose parents have had end-of-life issues and have navigated the healthcare system and stuff for them, when are they going to ever use that again, right? So he is using the story of Maxine, who had a pacemaker implanted 6 weeks before she passed away. Okay, that's making the cardiovascular researchers in the room flinch, as a story about why our healthcare system fails people at end of life, right? So anytime you can make that personal connection fairly early in your op-ed, that's going to increase your chance of pickup. Does somebody else want to share? I promised I'd be kind. But she's got all the elements there. She's got some numbers to start with. She's got a strong headline and a strong point of view, and that's the most important thing. That'll get you started. Anybody else brave? Come on, I'm kind.
That wasn't so bad, promise.
What's bugging you? I want to know what's bugging you. Even if you're not ready to read it out loud, tell me your argument.
So my title is Insurance Coverage Isn't the Magic Bullet for Young People's Health. Young people today, contrary to common sense assumptions in the ever-expanding wellness market, are not as healthy as we would like to believe. Ask any graduate student how they're doing, and their face will say it all. Millennials especially are suffering from a number of invisible health problems like depression, anxiety, and high blood pressure at higher rates than previous generations. When the Affordable Care Act mandated health insurance coverage and raised the age of parent plan coverage to 26, experts hoped this would improve health insurance coverage for a historically uninsured age group. And they were right, but it turns out coverage doesn't equal seeking care. As a country, we are now facing an issue of people getting sicker younger and not seeking the care they need at earlier stages. Bouts of depressed mood become incapacitating chronic depression, anxiety leads to panic attacks at work, untreated high blood pressure writes a prophecy of early onset heart problems, all among people with at least some insurance coverage. Why is this? Other authors have talked about millennial burnout, and that certainly contributes to poor health outcomes we see in many millennials, but it also highlights how unequipped my generation is to handle these early stage markers of adult transaction.
So first off, we want to applaud because who's following the news, right? The millennial burnout article has gone viral. Who's following the news? That's great. And this is a timely topic. So what I'm going to say is that I think you've got a lot of great points in your introduction. What do you want people to do about it?
I guess kind of see the issue from an angle besides, well, why don't people just
Okay.
go to the
Okay.
doctor?
So
Because it's not that simple.
okay. So maybe your point is that your call to action, right? You need a call to action. So maybe your call to action is policymakers and providers need to understand that coverage is not the magic bullet. And they need to develop it, or providers and policymakers need to develop ways to reach my generation that will encourage them to seek help early, right? And then you can paint a picture of the better outcomes. This is a great one for a story, right? Because, and I love the Ask Any Graduate Student, that puts a little bit of personal spin on it. You know, it gives you a little bit of color. That's a great way to do it. You know, you can talk about anybody that you know. You know, one of the things that I think appeals to, and this is me with my higher ed hat on, but, you know, a lot of what we're talking about in anxiety, depression, blood pressure, chronic disease is lost potential. Right? So lost potential might be a theme that you could explore there in terms of, in order for my generation to reach its potential, we need to do more than just make sure that they're insured. Right? Does that sound like something you might want to explore? Because that, I mean, I think that you really have the kernel of a great idea there. And you need, but we've got to think about what is your call to action, right? You know, Emily's call to action is, look, all these things that Medicare is doing that are pretty bureaucratic are not working. And here's what we really need to do. I mean, I would argue as somebody who just had a parent in a community hospital, and I'm used to academic medical centers, that it's because nobody reads, but standard of care. But think about, you know, what is your call to action? What do you want people to do next? What are you going to inspire people to do? And by the way, we all know, and this is me putting on my health risk communication geeky hat on, go read Paul Slovic and, you know, Mental Models Approach to Health Communication, but people react better to inspiration than to being scary, right? They react better and they behave better. So when you inspire folks, that's going to be more of a behavior changer than scaring them, right? But that lost potential story has a seed of or theme has a seed there that I think is important. And, you know, it's an interesting cultural issue that you're addressing and you're playing off, because, you know, the baby boomers are like, well, we all pulled ourselves up by our bootstraps. Why isn't there, what's wrong with this generation? You know, but people have been saying kids today since Aristotle, so we know it's a universal issue, right? Okay, does anybody else want to share? Oh, come on, I promise it's not that bad.
Guess I can try, but it's very short.
It's okay.
So everyone at some point of their life experiences pain. For a lot of people, pain becomes a chronic problem. It's a human nature to find a quick fix. Opiate medications can present this quick fix, however, it comes with many negative health consequences. What should primary care doctors do when they see a patient demanding opiates for chronic pain?
Молодец. That's a good start. That means well done in Russian. In a past life, I was a Russian historian, which is how you end up doing these weird jobs. So that actually, Dr. Kotnieva there has caught something that I didn't mention in my handout or in the earlier introduction, but she's using a rhetorical construct in a really effective way. Okay, so her assumption is we don't need to tell everybody there's an opioid epidemic, right? If you're reading, you know. What she's doing is saying, how do you, she's using a rhetorical question of what is the primary care provider supposed to do, right? And I can see a lot of different ways this can go, but you know, what can you do as a primary care provider? This is the kind of thing that could be a JAMA viewpoint, or it could be in the, you know, the Journal of the Family Practice Professional Association or Primary Care Professional Associations. This is something where you can offer, this is what we call news you can use, right? So that rhetorical construct of, we all know this is a problem, and we're talking about a whole bunch of policy solutions, but what can I do person to person about this issue? And again, that's making the political personal, and that was a really actually very effective construct to get those questions started and transition to your opinion. So well done, and also not in your first language. Anyone else? Oh, come on, people.
I'm curious, did anybody decide where you would want to submit an op-ed piece? Like, did you write that on your sheet? Maybe where to put things, or do you have suggestions?
You know, the best thing to do is look topically at who's writing about what you're interested in, okay? And offer a new viewpoint. That's the most effective way to do it. And it's really topically dependent, because some of us who are talking about, you know, the audience for a question about millennial zeitgeist and healthcare is going to maybe have a broader audience than why is Medicare's new regulations on rehospitalizations failing? Why are they failing? They're going to have different audiences, and they need to go different places. And that's where you can work with your PR people, or you can go and see who's writing about this. But, you know, there's a blogging platform called The Conversation. I know there's a blogging platform that UAB works on with Vanderbilt. Those are also places where you can gain an audience and then use, as I talked about yesterday, your social media presence to reach out and get it in front of people. But it's going to depend on how big the audience is and where you think that those people read. Okay, and your PR people can help you with that. But, you know, we know that cardiologists read the American Journal of Cardiology. We know that they do some viewpoints, right? So we know that the American College of Obstetrics and Gynecology has that kind of thing. They all do. It just is going to depend on how big your message is and how big your audience is.
Do you guys have ideas about where you would submit after hearing that?
Or anything that you know, or just raise your hand and tell me what you think your topic is, or what you think your call to action is.
Like I said, I've written one and I've submitted it 2 places and got rejected, but I definitely didn't do it this way. And no one in the comments said these are the things you should do to make it more op-ed and less like paper, scientific paper.
Yeah.
And so I'm definitely going to rewrite it. But
Okay, well, you know, I will offer, because the price of admission here, Becky knows how to get a hold of me. So if you want me to just look at it, I'm happy to look at it.
Appreciate that. Thank you.
Yeah, but and then, you know, and
I had good comments, but they weren't like this. You're writing it like a science paper. Because I definitely have like a historical introduction, and then I have like how I did my lit review, and then I had
flip your script, and nobody that cares about your lit review unless like there's somebody really obvious that you need to talk about, right? So if you're a neuroscientist and you're going to talk about, you know, the concept of mastery, and you don't try to refute Malcolm Gladwell, you're going to be in big trouble, because somebody's going to be like, what about Malcolm Gladwell, right? So you're going to have to say that, but in general, you don't have to do that kind of lit review. I mean, I keep hearing like presumably reputable people continue to cite the 10,000 hour rule, and I think that it has been thoroughly debunked, but hey. They like a good rule. And you know, the things that have cognitive stickiness are just that simple. So that's something to think about when you're writing op-eds, is that when you give a lot of, like in academia, we're trained to see all of the sides of it, and we're trained to give our opinion with qualifications, right? But if you want something to be really sticky in the public sphere, you need that soundbite. And that 10,000 hours to mastery is a soundbite that has just permeated the culture, right? So if we were able to say things like the stigma about getting mental health treatment in this generation of people is a tragedy, and you know, or we're able to say, you know, X lives are lost because of this thing. Those sound bites are sticky. People remember them. And so when I do the media training at noon, I'll talk a little bit about why you don't say really, really colorful things when you're doing a media interview about your research, because it'll get printed. Like when Fernando Pardo Manuel de Villanueva, who I love dearly, said that the people at Carolina were worried the collaborative cross mice were going to be all over campus. I was like, don't say that. And of course they printed it in the newspaper, and I got a call from the AVP and was like, why did he have to say that? I said, I know, I told him not to be cute. He can't help himself. He's very gregarious, but it happened. But in an op-ed, you can be a little bit more provocative about that. Okay, just try not to, you know, make your IACUC mad. Okay, anyone else have ideas? What is your opinion? Come on, be opinionated with me. Anyway.
So could I ask a question?
Sure.
So one of the things that's come up with this group is taking it to policy. So, you know, they're doing the research, writing op-eds, getting out there.
Mm-hmm.
How do they then take it on further?
Well, how you take things to policy is you work with, I mean, if you're in a university, you have a leg up. You have a leg up because you have a government relations office and they're tracking particular bills and particular issues. And there is nothing for a public institution that is better for your standing in the legislature to have a credible physician or researcher with great credentials and a personal story about how one of their patients or family members or somebody was affected stand up in front of the legislature and testify about an issue. And so if you make friends with your government relations people, that is a great way to take issues to policy. And, you know, it can just take an email that says, hey, did you know that we have these 3 or 4 policy experts here, or 3 or 4 experts on this topic? And, you know, we'd like to sit down with you and think about how we might influence policy at the state or the federal level, right? Your professional organizations will sometimes have training on translation to policy because they have an advocacy function. And that's another great way to translate to policy, okay? Because, you know, all the data in the world isn't policy. Policy is really just weaponized language, right? It's not, and all kinds of weird things happen. So I was in the middle of the USPSTF when they changed the recommendation on annual mammography. And, you know, I had people within our institution who didn't agree. And guess what? They all got to talk to the media. And they talked to, and we had people on the USPSTF who made the recommendation, and then we had surgeons who were losing their minds. And, you know, debate is great, but you can let your people know that you have that expertise. You know, let them know you have that expertise. I mean, you surgeons, medical errors are a huge one for surgeons, right? Because, you know, there's been all kinds of, and radiation oncologists and others, nuclear medicine, talking about patient safety issues. That's one where more clinical voices could help. I'll tell you, you've got to remember that your legislators are often people who don't have a college degree. And I'll give you a story with the names removed to protect the not very bright, but there was a point at which North Carolina Medicaid was going to prohibit solid organ transplantation for Medicaid recipients because the perception on the part of the legislature is that they were people who engaged in unhealthy behaviors, and if you give an alcoholic a new liver, they're just going to ruin that one too, right? Unfortunately, the way they wrote the legislation would have prohibited state Medicaid for paying for bone marrow transplantation for pediatric patients. So I had to prime the director of our BMT program to go over and explain to the legislature what exactly is a bone marrow transplant and who receives it and why, and the fact that most of them are, because it is so expensive and requires such a long hospitalization, that most of these patients end up on Medicaid. And do you want to be responsible for the deaths of all these people because you're not paying for it? Or, you know, the failure of the BMT programs in your state, which provide an essential service. Okay, so that's an illustration of sometimes how basic you have to be with people. But translation to policy, make friends with those people, work through your professional organizations. That's a great way to do it. I mean, that's a really sobering story. You know, I kind of laugh and say, okay, well, that was interesting. But at the time, we were like, holy crap. Right? I mean, who's going to go down to the legislature and tell them that they're killing 4-year-olds because they're not going to pay for bone marrow transplants anymore? Yeah. With acute leukemia. That's just not, you know, this is the same legislator who's probably doing some charity event in their district for a child with leukemia. It was crazy. Yes, yes, yes. They put exceptional language into the law and they allowed us to weigh in on it. Yeah. But it was like the people at Duke and the people at UNC and the people at Wake Forest were all calling each other going, "Wah!" They made it happen. Okay, anyone else? All right. Well, I'm going to stay here a little bit, and I have a call that I have to do at 10, but I have some time if folks want to come and consult individually. So thank you for being here and for your attention, and I know it's early on a Friday morning. But the diversity of this group and your interest is really wonderful. And I'm going to start putting a Google alert out there for UIB so I can see what you end up coming up with.
Thank you. Yesterday, Ellen said, I can't wait to say y'all.
So, yeah, I mean, I have spent a lot of time in the South. I'm from Kentucky, and I got 2 degrees at Carolina, and I've spent a lot of time in North Carolina. And up in New York, when I say all of y'all, they like, I get the serious side eye on that. Although we're hiring another individual from Kentucky, so we're going to scare them, I'm sure.
The other thing I wanted to say is welcome back from the new year, because this is our first session back at Friday Fellows this year. So thank you for being